Welcome to Beyond Fiction. Today, we're diving into a story that's not just unfolding, it's escalating. California, the land of sunshine and innovation, has declared a state of emergency. But this isn't about wildfires or earthquakes. It's about a silent and deadly threat that's been spreading under the radar: bird flu. California Governor Gavin Newsom made the announcement as the H5N1 strain of bird flu continues its alarming spread. This week, a 65-year-old man in Louisiana became the first severe human case of bird flu in the U.S. after exposure to infected backyard birds. The patient remains in critical condition, marking a critical turning point in how this virus affects humans. Meanwhile, in California, the virus has made its way into dairy farms, infecting cattle and heightening fears of broader outbreaks. Since its detection in 2022, bird flu has spread to herds in 16 states, with California seeing the highest number of human infections, 34 cases so far. While most human cases have been mild, the rapid transmission across species is raising red flags among health officials. Bird flu, or avian influenza, is a virus that primarily spreads among birds, but can jump to other species, including humans. The H5N1 strain, in particular, is highly pathogenic and has caused outbreaks in birds worldwide. It was first identified in 1996 in southern China and has since become a global concern due to its high mortality rate in humans. To date, the World Health Organization reports over 860 human cases of H5N1 globally, with 463 deaths, a staggering fatality rate of 52%. Most infections have occurred after direct contact with infected birds, their droppings, or contaminated environments. Fortunately, there is no evidence of sustained human-to-human transmission. However, scientists warn that the virus is just one mutation away from potentially sparking a global pandemic. In the U.S., bird flu was relatively rare until its resurgence in 2022. Since then, it has spread rapidly across poultry farms, wild birds, and even mammals like seals and foxes. This adaptability is what makes the virus particularly dangerous. Now, with infections confirmed in dairy cows, the situation has entered uncharted territory. Governor Newsom's declaration of a state of emergency is aimed at mobilizing resources to contain the outbreak. It enables the state to allocate funds, deploy personnel, and implement biosecurity measures to protect both the agricultural industry and public health. Experts emphasize the importance of early action, as outbreaks in livestock can have devastating economic and health consequences. The first severe human case in Louisiana adds urgency to this crisis. The 65-year-old patient, who had underlying health conditions, was exposed to sick and dead birds in his backyard flock. This case underscores how easily the virus can affect humans who come into close contact with infected animals. So how does bird flu spread to humans? The virus can enter the body through the eyes, nose, or mouth when a person inhales dust or droplets containing viral particles. This often happens in areas where infected birds shed the virus through their saliva, mucus, or feces. The Centers for Disease Control and Prevention, CDC, advises avoiding contact with sick or dead birds and taking precautions such as wearing personal protective equipment when handling poultry. What about food safety? The CDC assures that properly cooked poultry and eggs are safe to eat. The virus does not survive the high temperatures used in cooking. However, consuming raw or undercooked poultry, eggs, or unpasteurized dairy products should be avoided. Currently, there is no vaccine available for humans, but research is underway. In July, the U.S. government allocated $176 million to Moderna to develop a bird flu vaccine. Vaccination efforts for poultry have also been intensified to curb the spread among birds. The growing number of cases in California and the first severe human case in Louisiana highlight the urgent need for vigilance. While the general public's risk remains low, the potential for the virus to mutate and become more transmissible among humans cannot be ignored. This is a developing story, and the next steps taken by health officials, scientists, and governments will be critical in determining the outcome of this crisis. Thank you for staying with us. If you found this story compelling, please don't forget to support us by subscribing. We need your support to grow. We are trying our best to turn your scrolling into something meaningful.